this lecture, I'll be talking about the patient's role in non-surgical periodontal therapy, particularly their role in interproximal self-care. We know that clinician skill plays a vital role in successful periodontal treatment, but there's another part of that equation which is equally, if not more, important. Successful non-surgical periodontal therapy involves the patient in a collaborative way. We need to be co-therapists with our patient, and the goals of mechanical plaque control should involve both the hygienist's skill and the patient's self-care. If you found yourself in clinic recommending bass brushing and C-shaped flossing, you're missing the bigger picture. We need to step out of that fundamental box and start recommending self-care techniques which are individualized for the patient. I'm mostly going to focus on interdental cleaning in this lecture because we're on the subtopic of interproximal plaque control as it relates to periodontal therapy. But I'll start off by acknowledging that the most frequently used aid for biofilm removal is the toothbrush. Now, we want our patients to use their toothbrush, but this does little, if anything, for interproximal areas. Let's think critically about which type of interdental aid is best for the patient. Most of you probably recommend C-shaped flossing on the regular, but it probably would not surprise you to know that when given a choice, patients prefer other types of interdental cleaners to dental floss. Not only that, but dental floss is not effective at removing biofilm from root concavities and grooves. If your patient does not have type 1 embrasures with excellent self-care compliance, try recommending an alternative. I'll briefly mention the floss holder, but again, if the patient is not highly motivated with type 1 embrasures, this may not be the best choice for your patient. Tufted dental floss is a thickened yarn-like floss, which is good for type 2 embrasure spaces and fixed bridges. But there's still poor compliance, especially in patients with manual dexterity issues. An interdental brush, also called a proxa brush, is a good option for type 2 and type 3 embrasure spaces and exposed furcation areas. These have tiny brushes which can remove biofilm interproximally, even in concavities. They are easy to handle for patient dexterity issues and come in a variety of sizes for different types of embrasure spaces. An end-tufted brush is going to be like a proxa brush, but it's a bit thicker and it can accommodate a type 3 embrasure space. It's also good for misaligned teeth and exposed furcation areas. The last interdental cleaner I want to talk about is the water pick. Now, my disclaimer is that I have no vested interest in this brand. It just happens to be my personal favorite. There are different types of water flosser and they all work in a similar fashion and irrigate the gums while also removing plaque. Studies have shown that Waterpick can remove up to 99% of plaque and is 50% more effective at improving gum health versus string floss alone. Waterpick is great for braces, bridges, implants, and people with dexterity issues. Waterpick is great for anybody. So here's my challenge to you. Start recommending individualized self-care techniques that best fit the patient's situation.